Hey everybody, this is Dr. Sattler again, here with your question of the week. Okay, so this week's question says, when creating an assignment for a team consisting of a registered nurse, a licensed practical nurse, and two assistive personnels, which of the best which is the best client for the LPN? Option 1, a client requiring frequent temperature checks. Option 2, a client requiring assistance with ambulation every 4 hours. Option 3, a client on a mechanical ventilator requiring frequent assessment and suctioning. Or option 4, a client with a spinal cord injury requiring urinary catheterization every 6 hours. So let's go back to our basics of delegation. Remember, when we are delegating, first we need to see what the law says an individual can do. So what does our Nurse Practice Act say an individual can do? Then we need to see what our facility's policies are, because a facility can make stricter requirements, but they can't make looser requirements. For example, our assistive personnel could uh, collect vital signs on a stable patient, but every facility doesn't allow their aides to obtain vital signs on a patient, whether they're stable or not. So first we need to see what the law says an individual can do. Then we need to see what our facilities policies said an individual can do. Then we have to look at things. So in this scenario, we have an LPN and we have assistive personnel available. So yes, our LPNs can do everything that our assistive personnel can do, but we want to make sure we're using our LPN where we can best use our LPN. So if there's something we can delegate to an assistive personnel, then we want to delegate that to the assistive personnel and use your LPN where you can best use your LPN. So keep that in mind as well when we're delegating to individuals. Remember, the individuals that we delegate have to be stable clients. You can only delegate stable clients. So keep that in mind as well. And remember, we're not delegating any teaching. Now, keep in mind when we say teaching for an LPN, if the scenario says reinforce teaching, our LPNs can reinforce teaching, but they can't do any initial teaching or education. But if it has that word reinforce in front of it, then they can do that. So we're not going to delegate teaching. We're not going to delegate assessments. We're not going to delegate planning. We're not going to delegate any evaluation. And we're not going to delegate unstable critical patients. So keep those things in mind when we're delegating. So in our first one, a client requiring frequent temperature checks. So a client requiring frequent temperature checks, that is something that we could delegate to our assistive personnel. So we'll go ahead and delegate that to the assistive personnel. Yes, the LPN could do that, but we have an assistive personnel available. So let's delegate that to the assistive personnel. A client requiring assistance with ambulation every 4 hours. Yes, our LPN could do that, but we have assistive personnel available. So let's delegate that to our assistive personnel. Remember, we said we're going to use our LPN where we can best use our LPN. Number 3, a client on a mechanical ventilator requiring frequent assessment and suctioning. Now, yes, LPNs can suction. However, this client is on a mechanical ventilator. So they have something going on there. So something more is going on, and they're not necessarily stable at this point. So let's look at what our last one says. A client with a spinal cord injury requiring urinary catheterization every 6 hours. So individuals with that we have to catheterize, our LPNs can do that. The LPNs can definitely, do that on these individuals. And as long as, and the scenario didn't say anything about they just came in from a car accident, was, so they're not unstable or anything at this point. So we would go ahead and delegate that client with the spinal cord injury that requires the urinary catheterization every 6 hours. Okay, so as we said, our answer is a client with a spinal cord injury requiring urinary catheterization every 6 hours. So let's look at the rationale here. When creating nursing assignments, the nurse needs to consider the skills and educational level of the nursing staff. Frequent temperature checks and ambulation can most appropriately be provided by the assistive personnel. Considering the clients identified in each option. The client on the mechanical ventilator requiring frequent assessment and suctioning would most appropriately be cared by the RN. The LPN is skilled in urinary catheterization, so the client in option 4 would be assigned to this staff member. Something else I want to point out as well is said assessments. We're not going to delegate assessments to our LPNs either, so keep that in mind as well. Um, LPNs can collect data, but they can't do assessments. They can't do initial assessments on individuals or anything like that, but they can help collect data. So that is it for our question of the week. If you enjoyed this and would like to hear more questions of the week like this, then consider subscribing to my YouTube channel. Have a great day and enjoy the rest of your week.